Share
Hello,
screen.
everyone. My name is Jose Leon. I am with the National Center for Health and Public Housing. We are going to give a few minutes for those who are joining to make sure that they are able to be with us. We have two great panelists with us. So this is going to be very interesting. We are going to hear from we are going to hear about climate change and from a national perspective, from a regional perspective, and from a health center perspective. So again, this is a collaboration between the National Nurse-Led Care Consortium and the National Center for Health and Public Housing. We are very happy to be here. This is the second webinar of the series. Just to recap, we briefly discussed a couple of issues related to climate change. We had the opportunity to have Florida PCA collaborating with us. So this opportunity, we are going to have Jamie Burney again, and we are going to hear from Dara Stout. So please, next slide. Just some housekeeping items before we get started. At this moment, all participants are muted. If you want to engage, this is an interactive activity. So if you would like to ask a question, or if you have any comments, or if you would like to share resources, please engage in the chat, or you can use the raise hand icon that is at the bottom of your screen. And if you do it, your line will be unmuted. This meeting is being recorded, and slides, resources, and the recording will be sent to all of you after the webinar. Next slide, please. The learning objectives for this webinar are, we are going to briefly discuss the impact of climate change on high-risk populations. We are going to examine some health education strategies on climate change and identify public health resources for natural disasters. Next slide, please. Our disclaimer, we are the National Center for Health and Public Housing. We are funded by HRSA to provide training and technical assistance to health centers. We work very closely with health centers located in or immediately accessible to public housing. And next slide, please. This is a joint collaboration with the National Nurse-Led Care Consortium, who also provides training and technical assistance to health centers. And we offer a national perspective, and they also specialize or work very closely with those health centers located in or immediately accessible to public housing. However, the training and the technical assistance is for all health centers, regardless of whether or not they receive funding to provide services to those living in public housing. Next slide, please. And these are my colleagues from NNCC. If you have any questions, they are working on the logistics, and this is the NCHPH team as well. If you have any question, please let us know. Next slide, please. And we are going to have today, we have the privilege to have two greatest panelists. I am going to introduce Dara and Jamie when it's time for them to present. But Dara is with the Louisiana Primary Care Association, and Jamie is the Vice President of Behavioral Health Services at Open Healthcare Clinic. Next slide, please. In regards to health centers located close or immediately accessible to public housing, for those who couldn't participate in our first webinar, this is just a reminder on the number of patients that health centers serve, specifically data taken from the 2022. This is UDS data. And 483 health centers are reported to be in or immediately accessible to public housing. And in 2022, they served 6.1 million patients. Out of the 483, 107 are public housing primary care grantees. They receive funding from HRSA to provide services to this population. And in the same year, they provided services to over 900,000 patients. Next slide, please. Next slide. There we go. So in regards to the demographics of those living in public housing, we can identify some of the population that are going to be at risk because of climate change. Those living in public housing or the household reported that 38% of those living in public housing have a disability. And we have some minorities as well. 43% are African American, about 26% are Hispanic. And the other two high-risk populations for climate change or can be affected by climate change are those who are over the age of 65. 19% of those living in public housing reported to be 65 or more, and about 36% of those are children. So we need to keep that in mind if we provide services to this population and this special population, because we have many of the high-risk populations that are mentioned by experts on climate change, and we need to make sure that we have the resources ready to get in contact with them when they need it. Next slide, please. This publication is a great publication if you have the opportunity. This is a HUD and CDC collaboration on the status of those living, health status of those living in public housing. And again, this is just to show that there are some chronic conditions that are more prevalent in those living in public housing or living in HUD-assisted housing. And so patients with asthma, COPD, and those living in these public housing places are more likely to have diabetes, COPD, and asthma, or be overweight when you compare them to the national population. Next slide, please. As we know, climate change is a public health priority. We are working on climate change from a federal perspective, from a national perspective, from a community level perspective, and from a state perspective. And all the natural disasters that we are seeing are somehow related to the changes in temperature. So this is a map of the US showing where and the most frequent natural disasters that we can expect due to climate change. So this is a really good opportunity to assess the needs of our population based on these maps. It's my understanding that EPA has a really good tool, and the National Oceanic and Atmospheric Administration also has developed some resources and materials for health centers and for other organizations that we can go review and make sure that we have a better understanding of how climate is affecting our populations. Next slide, please. So in regards to climate change, we know that many people will, all of us are going to be affected by climate change, but there are some populations that are more likely to be affected, and because they have some issues we've been discussing, social determinants of health. Health centers have a lot of information and provide a lot of information to HRSA regarding this particular public health issue. We know where our people live, and we know whether we have a patient experiencing homelessness or living in public housing, or if they are migrant and agricultural workers. So all those are vulnerability factors that we need to keep in mind. also where we are located. We are going to hear from Dara about everything of some of the natural disasters that they are experiencing at this moment. And there are some biological factors as well. Not all of us respond the same way when we are exposed to extreme heat, for instance. If we have some chronic medical conditions, if we have some mental health conditions, that's going to be different if we have asthma or COPD or any other chronic medical condition. So we need to keep that in mind because it's going to give us the opportunity to talk to our patient based on any of the conditions that they are that they suffer and they are being affected by, and is going to give us the opportunity to briefly discuss with them the effects of climate change on their health. Also, in addition to chronic medical conditions, we need to keep in mind that there will be new and emerging issues. We know that vector-borne diseases is going to be an issue with climate change. We're talking about malaria. We have in the past we have chikungunya. We had other conditions being more prevalent, and we are seeing more cases. So we need to keep that in mind when we have a patient with a fever or we have a patient with malaise, and making sure that we also understand where we are located and the type of events that are affecting our populations. As well, we've been talking about social determinants of health. We need to keep in mind that in the future, food security may be an issue for our patients, and we need to start working with federal and state organizations to make sure that we are also addressing those kind of issues. Housing is going to be is already an issue, and for those who live in public housing, sometimes they do not have the facilities that they need, and it's going to be a big problem for them in the future when we have heat waves or we have any other type of changes in our climate. Next slide, please. So one of the biggest concerns when we talk about heat and climate change is issues related to kidney injury. Those, for instance, with diabetes, those with a chronic kidney disease are going to be more affected if, for instance, they get dehydrated. Patients with cardiovascular conditions can also experience stroke because of climate change. There are some issues in regards to pregnancy outcomes. There are some studies out there showing that we have premature babies, we have issues after labor, and all these are related to climate change. There are some impacts on mental health. There is more domestic violence when we have heat waves. And there are studies from NIH showing this type of issues, and cardiovascular and respiratory conditions as well are going to be a patient with cardiovascular and respiratory conditions are going to be affected because of climate change, and those with asthma, those with COPD, and even patients with who are current smokers. And we need to keep that in mind when we are advising those who are current smokers to make sure that they understand the impact that is going to have the environment if they are smokers. Next slide, please. So when we talk about climate change, heat waves, and all these natural disasters, we need to keep in mind three major elements. One is whether or not we are being exposed, the time, the duration of the exposure, whether or not we have some conditions. Sensitivity refers to anyone with any issues that can make them more likely to be affected. and the adaptive capacity. Let's remember that if you are young or if you are a young adult, it's going to be easier or more to adapt if you have 70 or 80 years. So we need to make sure that every time that we review um, the or patient's files, we understand the type of exposure that they have, how sensitive they are, and how able are to adapt to any changes in the environment. Next slide, please. So briefly, we have already mentioned that over 30% of those living in poverty housing are children. We also know that those who are socially vulnerable are going to be more likely to be affected. We have mentioned those migrant and agricultural workers working outside. We have talked about those experiencing homelessness. Indigenous populations are also more likely to be affected, older adults, people with chronic medical conditions, people with disabilities. And we have some training, and we have developed some training on how to improve healthcare on health services for those experiencing disabilities. And sometimes during emergencies, these are one of the populations that suffer a lot, because we tend to provide services to our population in general, and we don't tailor our strategies to help those with disabilities. Then agricultural workers that are working outside, and we mentioned the pregnant, breastfeeding, and postpartum women. Next slide, please. This shows how climate change causes an impact on those women who are pregnant. And I was mentioning briefly about some outcomes such as low birth weight and preterm birth have been linked to extreme heat events. There are some studies provided by the National Institute of Health showing this link. Also, how infants and toddlers, because they are not fully developed, they have biological sensitivity to be more affected by climate change, and they also have other risks such as asthma or other conditions that make them more prone to have heat-related illnesses. And then the school age and older adults. Next slide, please. So this is an issue that sometimes we don't include when we have a conversation with our patients. We discuss the condition, how they are doing. We review the blood work results. We go over some recommendations and resources, but sometimes we don't have the time, or we don't have in mind how the climate change is also affecting their their health. So we need to address the existing risks that they have. We have already mentioned chronic medical conditions. We need to talk to our patients about how the environment is going to affect their health, and then have a brief discussion with them on what they need to do and offer resources to our patients. So by doing so, we are making sure that we are addressing another determinants of health, because we talk about social determinants of health, but we also have social and environmental limitation for our patients. Next slide, please. The American Academy of Family Practitioners has some recommendations on how to talk to patients, some strategies regarding what is going to be the impact, making sure that we have the time to briefly discuss that when we have conversation with the patients. We need to make sure that we incorporate this in some of the visits. making sure that we convey a message, specifically if the person that we are talking to is at risk. Um, in regards to reimbursement, when I was reading this article, I found that even though there is no ICD-10 code for environmental justice, there are some a federal organization already working on how to include an ICD-10 code and making sure that there is some reimbursement for all. I mean, if Medicare, for instance, adopts some type of reimbursement, other systems will do as well. So these are ongoing conversations, and this is really interesting to keep in mind. And the other one is that climate change is a political issue. Sometimes we need to be very careful and we need making sure that we are not having any confrontation with those who don't believe or in climate change. So we need to make sure that we are addressing this issue from a health care perspective and not from a political perspective, and how these issues are going to affect their health if they don't pay attention to the issue. Next slide, please. So anytime that we have a patient, we need to make sure that we address any of the issues, either if this is a well-child physical examination, is an asthma visit, if the patient has allergies, or if we get a question from our patients, we need to make sure that we address those issues and we need to get prepared for any questions. We don't need to be an expert on climate change. We just need to make sure that we address from a health perspective what are going to be the inconvenience for patients or the risks for patients if they have any condition or is on part of any of the populations that are more likely to be affected by climate change. Next slide, please. So remember that we need to engage, that the conversation, sometimes we have to start the conversation, making sure that it's not just provide information, but share resources, build some partnerships with organizations, and making sure that we are always preparing. After COVID-19, as I said previously, climate change is the main public health concern in the United States and in the world. Next slide, please. Also, let's make sure that we include our CHWs, that we train our CHWs to have conversations about climate change with our patients. There are several organizations, including the World Health Organization, promoting the use of CHWs. And they can go to the community and talk about climate change with our community. Next slide, please. This is a brief case study that we had last week. Probably we are not going to go over this because Jamie has another case study that is about quite similar to this one. But just to make sure that we understand the climate change and how we can talk to our patients, remember that we start the conversation. Next slide, please. Making sure that we have the conversation with the patient, and when we are leaving the ramp let's make sure that we offer resources, we offer some advice, we make sure that we review the chart of our patients and make the changes that are necessary so our patients don't suffer from climate change issues, in addition to the chronic medical condition that they already have. Next slide, please. So next, we are going to hear from Dara Stout. Dara is with the Louisiana Primary Care Association, and she is the Training and Workforce Development Manager, who has also led emergency management for Louisiana Primary Care Association since 2017. Her emergency preparedness experience has included responding to the effects of tornadoes, flash flooding, one school shooting, and numerous hurricanes. She's a graduate of Louisiana State University. So good afternoon, Dara.
Good afternoon. As Jose said, my name is Dara Stout, and I have been with the LPCA working in emergency management since 2017. As the primary care association for our state, LPCA does not work directly with patients in public housing. However, we do support all of our health centers, providers, and staff in all types of emergencies. Next slide. You skipped one? Well, can you go back one?
Yeah, I'm trying to go back one. Sorry.
Okay.
This one?
Yes,
no?
thank you.
Okay, great.
All right. So the LPCA represents health centers from across Louisiana, and all of the state is in some way affected by the sometimes extreme weather we have here in Louisiana. And of course, in most cases, it includes hurricanes, tropical storms, heavy rains, flash flooding, tornadoes, and combinations of these. Next slide. Whenever there is a weather system that we expect to affect our state, we message our health centers through email. We send it to the CEOs and their executive staffs, and we tell them that we're here and ready to send aid as quickly as possible. So in that email, we include a link to our LPCA after event damage survey, where they can report any damages, shortages, or tell us that they're all okay and they don't need any aid. We also send them the survey after the event occurs. And this beautiful picture you see right here is Canal Street in New Orleans, one of our main thoroughfares within the city, pre-Katrina. Next slide. And at the top of this photo, you see Canal Street post-Katrina. And actually, I think it was actually worse than that before this picture was taken. The bottom picture shows just a small portion of the highway going through New Orleans after Katrina. The levee broke, and it left thousands of people without homes, and they're waiting right here to be rescued. I don't know if you can see, but there are signs, FEMA, please, here we are, help. Next slide. So to get back to something I said earlier, the LPCA after event damage survey was created by myself and one of our members of our IT team in 2021. And we've been using it ever since. It's a very simple survey to use. All you have to do is click on a link and it brings it up. Most of these, the questions on it are multiple choice. And so we have introduced it to our members in as part of each of our emergency preparedness webinars, just to remind everyone. And we'll have to keep doing that because of turnover. We'll always remind everyone that we do have the survey, and it has helped greatly in getting responses from our health centers. New slide. So although we do send the damage survey and all of our pre and post emails, it's also located on our My LPCA page. Our members can reach this page and the survey by using a unique password that's unique to them alone. New slide. So there are other humanitarian organizations. However, we have close ties to Direct Relief and AmeriCares, and we rely on them heavily. They usually notify us that they're on standby before we even contact them, before the event actually happens. So as soon as we learn of any problems we can solve, we contact these two organizations. They are our go-tos. And we've requested water, generators, fuel, medications, temporary buildings, and more. And they deliver. New slide. Okay, so again, LPCA does not work directly with public housing patients, but I thought I would spotlight a couple of instances where we provided help to our centers following disasters. I'm afraid, well, let me just go on. In September of this year, there occurred a high school shooting in a small town in Louisiana, in Greensburg, Louisiana. One of our FQHCs, Southeast Community Health Center, operates both a health center in the town of Greensburg and also a school-based health center in the high school there. After the shooting, we immediately were in touch with the CEO of Southeast, and we were able to help them by gathering LCSWs from other Louisiana health centers in the area for the benefit of the students and the townspeople alike. They were there probably a total of 6 days counseling townspeople and the students once they got back to school. Next slide. This is just a few photographs of our PPE distribution. During COVID-19, we provided all of our FQHCs around the state with masks, gowns, gloves, thermometers, more gadgets throughout 2021 and half of 2022. And beyond that, I will speak about Louisiana's serious lack of rain and the whole country's lack of rain causing the Mississippi River to lose volume. In the case of Louisiana, the salt water from the Gulf of Mexico has begun coming up the Mississippi River because there's not enough volume of water in the river to push back to keep the salt water from coming up. I did find that on Thursday, a new report came out which said that the water may not reach New Orleans at all. However, it has come up through very close to New Orleans. So all of the South Louisiana that is close to the Mississippi River has had to have water shipped in and has had desalination going on. And New Orleans and the parishes surrounding it are in the south of it are working on a new way to supply water to their areas because of this is probably an ongoing issue. So that's my story, and thank you for listening.
Thank you so much, Dara, and for sharing what is happening in Louisiana and providing some resources for those attending this webinar. Thank you. Next slide, please. So next we are going to hear from Jamie Barney, who is the Vice President of Behavioral Health at Open Healthcare Clinic. In her current role, she oversees the provision of services in the case management, housing, and behavioral health departments. Dr. Barney is the Vice Chair of the Louisiana State Board of Social Work Examiners, and she also remains an active member in the Greater Baton Rouge area chapter of the Association of Black Social Workers. Dr. Barney's interests include efforts to improve services to persons living with HIV and combating the HIV pandemic, ending homelessness, reducing stigma surrounding mental health and substance use disorder, and securing resources to address community needs. Good afternoon, Jamie.
Good afternoon. Thank you for having me again. Open Healthcare Clinic, our legal name is HIV/AIDS Alliance. We were established in 1995. We've been providing services since that time, and I did speak a good bit during last week's presentation about our organization. And so for this week, I am going to focus on the services that we provide in relation to this presentation. But we have been a federally qualified health center since 2015. And you can see from the little map that's on the screen where Baton Rouge is in relation to the state. Next slide. So these are the services that we provide, and they range from primary care and pediatrics to behavioral health services, pharmacy, a lot of testing, and support services. Next slide. So we heard some information about how there are some populations that are disproportionately affected by severe weather events and other disparities. And so we are going to be going over a case study, and the family that we discuss includes a person living with HIV, a person who had some issues with housing as a result of a severe weather event, a mental health diagnosis, and low income. Next slide. Okay, so in August 2016, there was a 52-year-old woman that was the head of household in a family of 5. She resided with her daughter, 2 minor grandchildren, and her minor son, and her household income consisted of Social Security disability and her daughter's employment. She was diagnosed with HIV, bipolar disorder, and schizophrenia, and she was receiving medical care, Ryan White case management at Open Healthcare Clinic. She was accessing mental health services with one of our community partners, Margaret Dumas, and she was residing in one of Open Health's HOPWA-funded project-based programs, a 3-bedroom home. So she had a stroke and was hospitalized for 3 weeks. While she was hospitalized, there was 4 days of rain resulting in a flood. There was no anticipation of severe weather at the time. Initially, her home was inaccessible, but when she did regain access, most items in the home were ruined. There was 2.5 feet of water in the home that she had been residing in for 6 years. Okay, next slide. So there are several names that are used to describe this event. It goes by the Great Flood of 2016, the No Name Storm, and a 1 in 1,000-year flood. So the rain, like I said, lasted about 4 days, and it left behind more than 3 times the amount of rain dropped by Hurricane Katrina. During this time, this was the first time in history that flooding forced the governor and his family out of the governor's mansion when there was chest-high water in the basement. And unfortunately, during this weather event, there were 13 individuals who lost their lives due to flooding and about 41,000 housing units damaged. Next slide. So immediately, back to the patient we're discussing. I'm sorry, back to the community after the flood happened. So immediately returning to work, our Ryan White case manager started taking action to locate their clients and identify client needs. At the time, we had 1 behavioral health counselor at the agency who had just started 1 month prior, and she was focused on supporting new and existing patients while also offering support to staff. Our housing case managers, we had 2 housing case managers. They were working to identify which clients were displaced and assessing damage to the property's Open Healthcare Clinic actually operates. So we have 1 apartment complex and 8 standalone housing units at the time. And then our medical staff were working to locate patients, identify the appropriate pharmacy for patients who were displaced, and send medications for those who no longer had access to the medicines, and having medical visits as needed. So we were taking a lot of walk-ins at the time. Meanwhile, the staff was doing all of this while a significant number of them were displaced, while they were themselves hosting family and friends who were displaced, and while they were working to repair damage to their own homes. And then also my first day here was August 16th, which was right after the flood. I actually was delayed a few days because our neighborhood was flooding and we evacuated. Next slide. So back to our patient. Upon release from the hospital, she and her family moved in with her mother. They stayed with her mother for approximately 2 months. And this was common in the area. As the article notes, there was one family that lived in the same community, and there were 13 homes destroyed within that one family. And another issue our community had is a lot of this flooding happened in areas where that were not considered flood zones. So a lot of persons did not have flood insurance and were then without a home. Next slide. So these were some notes that I located from an operations report in September, which was right after the flood. So at the time in our Ryan White department, we had 417 persons getting case management. Within a week of the flood, they were able to contact most of their clients. Initially, there were 50 persons displaced, but at the time, which was approximately a month later, 15 remained displaced. Everyone who they identified that did not have medications was able to access medications within 48 hours, no matter where they were. And they were able to provide for most immediate needs with connection to resources, but formula, sanitary napkins, and rehousing was still the greatest needs. And then within our housing program, 8 of our housing clients were displaced. 4 were still displaced about a month later, and we were working with our funders on funding repairs and reallocating dollars from our project-based housing programs where the homes were inhabitable to tenant-based housing. Next slide. So the patient that we discussed, she was able to continue to access mental health services with the community partner. And she also continued services with her Ryan White and housing case manager and her medical provider, all with Open Healthcare Clinic while she was displaced. And we also are, as a community health center, of course, we can provide medical and mental health services to all patients. And so in 2018 for National Health Centers Week, there was like a superhero theme. And so that's a clip of one of our Ryan White case managers, a counselor, a provider, someone in marketing, our eligibility screener, and a dentist at that time in that department with the hero theme. And I thought it was fitting to slide it in here. And I thought it was cute. Next slide. And also of note, throughout that entire process, the patient remained virally suppressed and continued to access medications. So specifically with behavioral health, I just want to speak a little bit about how these types of events can have a significant impact on the mental health of persons in the community. So depression symptoms usually increase, and that's going to be generally the persistent feeling of sadness or loss of interest. And it can lead to a range of behavioral and physical symptoms. And then also anxiety symptoms, feeling nervous, restless or tense, and having a sense of impending panic or doom. And then with post-traumatic stress disorder, you have persons who may have nightmares or unwanted memories of trauma, avoidance of situations that bring back memories of trauma, and heightened reactions to anxiety or depressed mood. So even just rain may trigger a severe anxiety because that event started as rain. And keep in mind, we had a lot of persons who had relocated to Baton Rouge from New Orleans following Katrina. And then after they get here, they lost everything again during this flood to the rain type situation, water. And so it's very stressful. Next slide. So, and on that previous slide, you don't have to go back, but on the previous slide, that was from an article speaking about the mental health of persons who went through the flood in the Baton Rouge area. And so this is just some information on how much stress affects the body and why it's so important to make sure we're integrating behavioral health and primary care, and we're reducing stress. So with the brain, there's a lot of concentration problems and sleeping issues that can occur. You have increased heart rate and a risk of heart attack. Your immune system is impacted, and there's a reduced ability to fight and recover from illness. In men, you can see lower sperm production, and in women, increased period pain, aches and pains to the joints and muscles, and lower bone density. Next slide. So there are a multitude of things that persons can do to address their mental health in response to stress or in general. And this slide lists those different things. Different things work for different persons, so we need to be very careful about not stigmatizing mental health treatment that may help someone else, or telling someone, oh, that's not going to work, because what may not work for you may work for them. And so there are a lot of things people can do themselves, like behavior activation, just getting out, going around other people, being active with things like consumer advisory boards. Primary care providers can offer assistance. And also there's psychiatric services or medication management. And now we have, in addition to the ones listed under emergency crisis, the 988 option for behavioral health services. Next slide. There's also a grounding technique that works pretty good in with PTSD. And so one of those techniques, there's different ones, is the 5, 4, 3, 2, 1 method, where you work backwards. So you think of 5 senses that you notice. So you might say 5 things you can hear, 4 things you can see, 3 things you can touch from where you're sitting, 2 things you can smell, and 1 thing you can taste. It doesn't have to necessarily be in that order, but the point is to realize that you're safe and see where you really are. And then also, we are proponents of the trauma-informed care model. And so with that, we want to realize the widespread impact of trauma and understand that there's, different pathways for recovery, recognize signs and symptoms, integrate that knowledge into our policies, procedures, and practices, and actively work to avoid re-traumatizing any persons. So we had to recognize we needed to give our patients and our staff a little more grace during this time, because everyone was dealing with a lot. All right, next slide. So with our patient, the patient and our housing case manager were able to identify safe housing for the patient. The agency was able to reallocate some of the project-based funds to our tenant-based rental assistance program. The patient was transitioned to the tenant-based rental assistance program and placed in a 3-bedroom apartment with the family, with the continued use of HOPWA funds. We also were able to utilize HOPWA funds to renovate that home, and the renovations were complete about a year later. The cost of contracting and ability to find a contractor was up. At that time, it was pretty difficult, so it took a while to get it renovated. But after that, we were able to move another family into that home when it was completed. And again, throughout that entire process, the patient remained engaged in care and remained virally suppressed. Last slide. So these are those areas of focus for emergency management. So we have an emergency management team that is convened by our CEO or COO when there is a severe weather event. We do it in preparation to make sure we have the needed supplies, everyone knows what their role is, and we're ready to start contacting all of our staff and patients with information they need. We also make sure we have the technology available that would be beneficial in these type of events, and kind of reassess what we have and where we are. We do tabletop exercises with LPCA that are very helpful in helping us think about what we need to have in place and what the best steps are. We plan our changes in operations, specifically with our pharmacy, housing, medical team, behavioral health And we have specific messaging to vulnerable populations that we put out. Additionally, we make sure we have a multitude of ways to communicate with our patients and our staff. So with our patients, we are using our electronic medical record, social media, and signage. With our staff, we have a text function, text HR. We use email and our 3CX app. And then with our community partners, we are using email and phone when those become available, but we're making sure we're communicating with them the patient needs that we see, any changes to our processes, any exceptions and allowances they'll make in order to meet patient needs, and keeping up with any additional resources like FEMA, making sure patients know how to do that and helping them as necessary. In our response, we're making sure that we are checking in on our staff's mental well-being and that they're getting their need. We try to minimize service disruption. So even we identify early on a skeleton crew. It's really helpful to know who lives close and who would be able to come in if what we think is going to potentially be an issue with severe weather, who could get in so we can have someone here, and then which staff have the ability to provide services virtually. And again, we keep up with additional resources. We make sure we have our meds in stock, and we have on-call providers available. And so I think that is it. Yes. And thank you for listening.
Thank you, Jamie. Thank you so much. And thank you, Dara, as well, for your wonderful presentations. We are going to start a Q&A part of the webinar. So if you have any questions for any of us, please make sure that you type your question in the chat box. Or if you would like to ask your question verbally, please use the hand raise icon and your line will be unmuted. We have some questions that Dara has already answered. And a comment from Francis Marrero in Puerto Rico, saying that in Puerto Rico, they have learned from all the natural phenomena that they have experienced, and she can assure that their health centers in Puerto Rico have been strengthened and prepared with resilient structures and personnel. Thank you, Francis, for sharing that. Please don't forget the survey after the webinar. Your responses are very important. So please make sure that you have a few minutes after the webinar to complete the survey. And there is a question, and this is a question for Jamie. Do you have any, or do you have, and if so, please share a procedure or protocol for serving patients and community experiencing a flood or other natural disasters? Especially interested guidance when serving the elderly, disabled, or those experiencing mental health issues.
So yes, we have a emergency management plan. I don't know if that's something that I would be able to share with this group, but we are required by HRSA to have an emergency management plan that has to be updated and reviewed annually. And as a part of that, we have different codes and specifics about how to respond to emergent situations. In regards to those specific subpopulations, the elderly, disabled, and mental health issues, it varies depending on what type of emergency it is with the natural disaster and what service that person is getting. So we are just really big on communication. So we push out messaging through our EHR and our social media. And then we are communicating if they're in case management, that's a little more intensive. Just making sure they're aware of like where shelters are if they need to access them and how to access medications, make sure they have it stocked up. And persons who are disabled, the same, like where you can go if you need to get out and go somewhere else during the weather event. And if not, what to do in case you have problems or trouble.
Thank you so much for that response. Also, from a federal perspective, we have some federal organizations providing, and developing protocols. We have the Administration for Community Living they do a lot, and they provide a lot of resources for those patients with disabilities or those who are seniors and are being served by any organization, specifically at the community level. And SAMHSA, for those with mental use disorders, I'm sorry, is this the Substance Abuse and Mental Health Disorders Administration. So they also develop materials for these particular populations, and those are really good sources of information. Those are free and they can be tailored depending on your needs. All right, and then there is another question. This is for either Dara or Jamie. Do you have any screening tools you have developed and used that would be helpful in treating patients that have experienced or are experiencing the impact of climate change in general?
I would, so I don't have a screening tool specific for natural disasters, but there are some evidence-based tools for mental health issues that are widely available. So for depression, we use a PHQ-2 and then a PHQ-9. For anxiety, there's a GAD-7 screener, and then the name of the PTSD screener is escaping me right now, but the diagnostic manual that we use for mental health, the DSM, they have like some valid tools that are recommended for use in a DSM. And so clinicians that screen for those would have access to those. And then also if you have an electronic medical record, like we use Athena, there are some screening tools for different types of mental health disorders built into that system that are also evidence-based.
All right, thank you so much for that. And I think that this is a follow-up question, Jamie, regarding the what you said about the emergency preparedness plan. The question is, does HRSA provide guidance on the health center emergency plan that you could share?
HRSA does provide guidance.
Mhm.
I cannot tell you exactly where to get it because I'm not a part of the HRSA team, but they do have guidance and specifics about what has to be included. And I saw someone put something in a chat with a template of an emergency operations plan posted on the National Nurse-Led Care Consortium. That word stresses me out. I'm not going to try it.
Okay, it's a long title.
I'm sorry.
Yeah, so I just wanted to let everyone know, I shared 2 templates in the chat. These are formed in partnership with the New York Community Health Foundation, Chicanes. These were developed specifically for health centers, and they take into consideration the CMS final rule requirements for emergency preparedness. So these are out of the box, ready to be completed, and will help you meet all regulatory compliance for federally qualified health centers and lookalikes. So it doesn't mean this, takes the place of a rigorous program, but it is ready and waiting, for you to complete with your emergency preparedness staff, whomever that may be. Yes, Robert, they should be right above our chat. And we can include this with our emails that go out after the webinar. There's one for communications, which is part of the preparedness kind of business continuity plan. And then there's one specifically for the plan itself.
Thank you so much for that. We are at the top of the hour, so I want to thank again Jamie and Dara for the opportunity for sharing their experiences with us. And we have learned from them from a health center perspective, from a primary care association perspective. And we are very pleased to have both of them sharing all that information and expertise. Again, please make sure that you complete the post evaluation survey. And if you have any questions, please feel free to contact either the National Nurse Care Led Consortium or the National Center for Health and Public Housing. We are going to send them the slides, the name of our team members, and email addresses are there. So please feel free to reach out to any of us. I don't see any additional questions. So thank you for attending this webinar. Have a great afternoon.